the goal of chemotherapy? So the goal of chemotherapy is basically to get rid of the bad cells, right? So we want to kill and break down those cancerous cells. So if you kill the cancerous cell really, really fast, the kidney can't keep up with the substance that comes from the breakdown. So when the cells break down, they release a substance into the blood. So if your kidneys can't keep up with all the substances, that can lead to those substances staying in the blood, which is tumor lysis syndrome. So this patient is going to have an increased potassium, increased phosphorus, increased uric acid, and decreased calcium. So let's think about it. Let's say if you have a patient who already had kidney disease before they got chemotherapy, this patient is definitely going to be at risk for tumor lysis because their kidney is not already working at the highest capacity that it should be. They are